endometriosis. And my guests again are with me in studio, Dr. Yamal Patel. He is a hysteroscopic and laparoscopic. Oh God, should have seen me rehearse this word. Laparoscopic surgeon, specialist in endometriosis surgery. Karibu sana doc, thanks for coming. And of course, Wadhana Waroi, who is an endometriosis warrior. Karibuni sana, thank you for making time. Now, the statistics are shocking, doc. I'd like to start with you because I said this when we were, at the beginning of this show, and the World Health Organization estimates about 190 million reproductive age women and girls living with endometriosis.
Yes.
That's huge.
It is. 1 in 10 women, to be precise. So 1 in 8 to 1 in 10 women. And that is those that have been diagnosed. So we can say there could be more, but definitely not lesser than that.
1 in 10.
Yes.
Wow. Well, then, this is where I rope you in because I want our viewers to understand your story in regards to our discussion tonight. So take us through it.
So I normally struggle with saying when I got endometriosis. I think for me it's, I started my menses quite early. At around 11 years, I started my menses, but I was only diagnosed in 2017, yeah? So it was a journey through high school, through campus. Whenever I had my periods, I would have to go to the sick bay or I'll have to be taken to the dispensary because of the pain. It was just crippling pain. Yeah, so with time, the pain now, it just moved from being around only during my periods, but then because I had it, and Dr. Amal is the doctor who diagnosed me in 2017, I started now having other symptoms which were related to the endo being on other organs in my body. So half the time you'll find that doctors were actually treating the symptoms or trying to treat the symptoms, but no one actually would tell me, as much as I knew and as much as I was seeing a few specialists through the journey, no one had pinpointed out what the issue was. So by the time I was meeting Dr. Amal, I was mentally at a very bad place. I had even quit my job because I wasn't getting understanding. Because you will say you can't go to work. I can't show up to work for like 2, 3, 4 days sometimes in a month. And people don't understand why, or because you don't look like you're sick, yeah? So yeah, it's been a journey filled with so much pain, but walking through it with Dr. Amal has led me to a point where I have quality of life. Yeah.
My goodness. And I appreciate you coming and you opening up and talking to us about this. It's definitely not easy, I can tell even from your voice, but I appreciate it so much. So I want to take you back to, you said you started your menses when you were 11 years old.
Yeah.
So is that when this pain, this extreme pain started?
So initially it wasn't extreme pain, other than the fact that it started early, but going into high school, it's when now the pain was crippling. I can attend classes, you can't even study during the time, just slightly before your periods, and when you're on your periods, the flow is quite crazily heavy. The pain is immense. Yeah, so that's high school going all the way to campus and just before I was diagnosed. Yeah.
And I want to know, do I say reaction of your teachers, your high school teachers and your classmates, for instance, because then I would imagine, because there was not much awareness on this condition, people probably did not or refuse to understand what is happening with you.
People don't understand, and sometimes I feel like when people, they don't know about something, then as much as you can talk about it, then there's that lack of awareness. There's really not much they can, I don't know, they could do something, but at my time in high school, my fellow students will actually say she's pretending. I'm having periods, I'm able to attend class, I'm able to do my daily duties. Why is it that when she's on her periods, she's like almost dying? There's that judgment, and sadly for me, I've experienced it a lot from women. Because they're going through the same thing and they want to assume, or rather they assume that your periods should just be equally the same. Yeah, they don't understand that your life is around your periods. Everything that you're doing, whether it's events, everything is, if your period is happening a certain week, you can't put anything there. You can't schedule anything there. Yeah, so it's been tough.
And did that judgment do anything to you, especially as because I'm looking at you as a child in the high school, we were kids then, we were children.
Yeah.
And here is the world judging you for something that is beyond you, for something that you cannot control. Did it do anything to you?
Yeah, it does something to you mentally, because you know what you're feeling. You know what the kind of pain that you're dealing with. When you go to the sick bay and the nurse gives you a Panadol, it does nothing to you, yeah? So it affects you mentally. And as I was telling you, getting to a point where I am leaving employment without another job to go to just because of where I am at mentally. And I feel like that was the right thing for me to do then, because then I concentrated on my treatment, sought after doctors, got Dr. Yamal, got diagnosed. So it was somewhat a relief for me. There was some sort of validation. Although at the time I didn't even understand what endometriosis is. For me it was Fuchs. There is a name. There is a name to this thing that's been haunting me, Yeah.
Okay, and I shall come back to you. But Doc, I want us to break down endometriosis, because there's someone, who's watching us right now and probably doesn't even know what we're talking about.
True. So endometriosis, it's a condition that actually is associated with lots of, issues around the female and general reproductive health. It's defined basically when you have the endometrium, which is the lining of the uterus, like cells growing outside the uterus. So it could be growing in the tubes, in the ovaries, behind the uterus, in the surrounding structures like the bowel, the bladder, and it goes as far as every other organ. There's been endometriosis found in the brain, the eyes, in the nose and ear, in the lungs. So it can go anywhere. It's a systemic disease. But more importantly, what is important to understand is it is chronic, it is debilitating over time, it's progressive. It has a bad issue with, therefore, mental issues and family issues. So you've heard, it has lots of implications on even the psychological well-being of a girl and woman as she's growing up. There is a lot of misunderstanding around this disease, so it's often misdiagnosed or missed out as a diagnosis, unless you are seen by somebody who deals with this on a regular basis. Yes. So the main things that surround it is usually pain. And when I say pain, initially the pain might be around period times, and it could be pain with periods, it could be pain during sexual intercourse, with pain while passing urine, pain while passing stool. So it has pain-related issues. And then it can get pain during ovulation, and then chronic pain, the way she said. It becomes centralized. So when you get centralized pain, it's very difficult because now it's there throughout. Maybe with worsening around period time, but throughout. The second aspect that it deals with is reproductive, which means these women generally suffer from issues with fertility. So many of them may normalize pain, and that's what our society has been doing so far, that you're told by your sister, your friends, your mother, your aunties that, listen, stop being such a sissy, stop behaving like you're the only one who's having periods. We've been through this and we had pain too. But then it's very different when you have endometriosis related pain. So we shouldn't normalize these symptoms. It's better to have it checked out, because if we pick up endometriosis early, and that's where education and this awareness comes in, we might be able to timely manage it. And if we timely manage it, we might be able to therefore control it better than someone in whom it's now involved all these structures, including the rectum, the bladder, infiltrates into the ureters. People lose their kidneys as well. Almost 11 to 15% of women with endometriosis have kidney loss. They go into kidney failure, and then, so it's really a devastating disease.
Right.
So that's second thing about fertility. And yes, there is always a solution out of it, but the sooner you pick it, the sooner you treat it, the better the outcomes.
Yeah.
And the third thing can be psychosocial. So these women have lots of psychosocial issues. Like we have cancer awareness and support groups, this is one of those few conditions where we've had support groups. Because these women really suffer, and I've had to deal with many with depression and some with the extent of going to have suicidal tendencies because they just can't take it anymore. And I think that is something we shouldn't allow. So let's give these girls and women a chance to live like a normal woman. That's the whole idea of awareness, education about endometriosis, and proper treatment.
Right. And you've mentioned the diagnosis, you've mentioned management, you've mentioned fertility, and you've mentioned the treatment, and we shall get to that in detail. But Doc, I was surprised in my research because I found out that it has stages. Stage 1 all the way to, I guess, stage 4. I honestly did not know that.
Well, that's the older classification. We today don't stage it in that group anymore because it has not helped us with our management and it has not helped us with understanding symptoms. What I mean by that is someone with a stage 1 could have extreme symptoms, and someone with a stage 4 with a complete frozen pelvis where everything is just matted and stuck together may still have lesser symptoms than the one with stage 1. And sometimes it infiltrates nerves, and then the pain is just excruciating beyond any control, but it may not be a stage 4 disease. So staging is now phased out. I would say we now do different classifications. So we classify the disease based on where it's involved and how much of it is involved. And so there is something called Enzian classification that we use. And that is the way that we now can stratify someone's extent of disease.
All right, okay. I shall come back to you, Doc. But then I want to take you back to something you said earlier, which is finally it has a name.
Yeah.
You know, this condition that I've been battling for years, finally there is a name for it. And this is where I want you to talk to us about your diagnosis. I mean, clearly it was a relief, you know, when you were diagnosed and you put a name to it, but take us through that.
Okay. So when I was first diagnosed and we did all the tests, the scans, it was pretty bad. I guess that's the time when you were still doing in staging, because I was a stage 4. So my stomach, my small intestines, my pelvic, it was
the ovaries,
my inside was like
rectum,
one big ball.
It was
everything was joined together. And I remember that time I was scared, and I'm really blessed that Dr. Amal is an empathetic doctor, because as much as I had that relief, the relief came first, and then sadness filled me, and I got really emotional in his office, because what he was telling me was not what I was expecting. I did not know how crazy my insides were. Yeah. So we did the first surgery then, got quality of life, and then unfortunately, because of the late diagnosis, it came back. Had to do another surgery in 2019. I am much better right now, only that it's on my bowel again, so we might have to go back soon and just deal with that. But I have somewhat quality of life. I cannot compare my life now to how it was before I had the surgery. Yeah.
But then again, your life, what is it like, you know, having to live with this condition, say on a day-to-day basis? Like you said earlier, when you're planning, say your schedule, you have to consider this. How is it like?
It's not normal, but I think because I have had to do it almost through my life, it has somewhat become normal, but it has also limited my interactions with people. I keep my family very near to me because they've been very supportive, and I'm blessed to have them. I also have a very small circle of friends, because at the same time, not everyone understands when you say you keep on canceling on events or on meetups or stuff like that because you're unwell. Not everyone understands. Some people might take offense, but I am blessed to have a group of few people who have been understanding and are like my pillars of strength when my walls are crumbling. Yeah.
Right. Now, Doc, you mentioned painful intercourse, you know, as one of the signs or the symptoms of this condition. And I'm asking this because I know you're here in your capacity, you know, as an endometriosis surgeon and hysteroscopic and laparoscopic surgeon, Doc. But that bit by itself, the painful intercourse, is bound to affect many relationships, especially when the man does not understand when it's only you who feels this excruciating pain here. So what is it that you wish the men would know, and yourself being a man? And this is also part of awareness, it should be.
I think very rightly said, and I think it should come out very clear. I would say not less than 50 to 60% of my patients with endometriosis have family issues. And this is probably the main reason. Once, twice, thrice, someone might understand. But after that, unless they are aware of what's going on, they don't want to understand. When the woman is trying to just shove them away and say, no, I'm not ready. No, I'm afraid. No. I mean, it eventually breaks families. And that's exactly what I would like to tell the men out there, that when that lady is saying no because of pain, I think let's look at it differently. There must be a reason that she's doing so. I don't think she's in that relationship to come and just say no. So endometriosis in that situation is usually the type that we would call deep infiltrative. There are three varieties. One is ovarian, one is superficial, and one is deep infiltrative, which is the most extensive and bad kind. So this deep infiltrative, if it is anywhere near the upper area of the vagina, I would say that this woman would definitely experience extreme pain every time she's trying to have intercourse. And it's deep pain. It's not the entrance pain. It's not superficial, it's deep pain. So when that happens, I would urge these couples to come and have a checkup and say, listen, this is what happens. Could you please check? And I can tell you for a fact, when they go to routine doctors and routine scan places, it will never be picked up. So you see, they'll always come back with a report saying normal. And here is this woman really in pain, in agony, and refusing even sexual intercourse. So that's where the problem starts, because there is no one who's picked it up. So I would say they need to have it checked with an expert or a center that deals with this, pick up where the problem is, and then comes the journey of the solution.
How exactly is this diagnosis made?
So there are no blood tests to pick this up. So it's basically a clinical diagnosis, and it's basically a diagnosis of imaging. The best imaging modality today to pick up this disease would be an ultrasound diagnosis, which is preferably done transvaginally. So if a woman is already active sexually, we can do the transvaginal scan. If not, then they sometimes do transabdominal, but that's not accurate enough. And in those cases, then an MRI of the pelvis could help. So the diagnostic modality of choice is a transvaginal scan, ultrasound, and preferably done by someone who understands endometriosis, not even just by normal radiologists or sonographers who may not understand the clinical aspect of the disease. So it's clinical exam, history taking, and the ultrasound.
How about the causes?
The
causes of endometriosis.
The cause?
Yes.
Well, I would say that this is a very complex disease. It's actually even called in some places a disease of theories. What we mean by that is there's so many these theories postulated as to why it happens. None of them answers all the questions, and none of them is wrong in itself. So when there are 5, 6, 7 postulated theories all saying this could be because of this, we could answer one patient's symptoms with one of the theories, but then when you go to this other one, you'll be like, no, but that doesn't explain why she should have gotten it. So there's tissue injury and repair, there's retrograde menstruation, there's coelomic metaplasia. There's so many different theories, medically speaking, but none of them answers. So it's not genetic. So you can't say that.
I wanted us to get.
Yes, it's not genetic, but we have seen many situations where 2 sisters have it, and where a mother had it and now the daughter has had it. But I don't think it's genetic. It's just by coincidence that yes, these 2 developed it. So we can say there is some sort of relation between blood relations. But we don't have a theory that explains why it should happen, because we've even seen 2 sisters totally different, but we've also seen 2 sisters having similar extensive disease. Take this example. I mean, I don't think we have a similar situation with her, all right? So there's no genetic predisposition per se.
Right. Watano, based on what Doc here has said, I want to ask a question that most of us sometimes ask when we're faced by, circumstances and situations that we deem unfair. Why me? Have you ever asked that?
A million times. A million times. Especially when I was going through the most in terms of pain. And as much as I ask myself that question, there's something my mom keeps on saying, is that because you're strong. She says because I'm strong. I don't think I'm strong.
I think you are. I'm telling you by the fact that you're here tonight.
Yeah.
You clearly are.
Yeah, so I do ask myself that a lot. But as I said earlier, I have a very good support system. I have a very empathetic doctor. I have a family that would move to the moon to help me figure it out. Even when I was having my first surgery, I remember I said I was out of a job. I didn't have any insurance at that time, but they made sure I got the surgery that I needed. So I think to answer myself that same question, I am doing it through trying to create awareness on the same, hoping that someone else who has the same symptoms that I had or was experiencing, can hear this and so seek the help that they need.
Right.
Yeah.
Right. Most definitely. Right. And my director, Kevin, tells me it's time for a break. So let's take that break. Stay with us. We come back with this conversation on endometriosis.